Hey guys, my name is Mark Frilling. I'm a third-year resident here at Case Western's ENT residency program. I'm going to do a day in the life here. I'm currently on our VA rotation. Normally we have a PGY 3 and a PGY 5, and then for 1 month of our 3-month rotation here, we have a PGY 1 with us too. But today it's just me, so we got a pretty full day. We got a little bit of everything, so I'll take you through a day with me. It's 5:30 in the morning right now. Just about to leave the house. All right, so I made it in. It's almost 6 a.m., so I get signed out from our UH night float resident around 6 a.m., which is Henna right now. And then later today, I'll be signing out about 5 p.m. is typically how it works. Our VA is located like within 5 minutes from UH, so our night float resident covers the VA at night. So basically when I get in, I'll look up stuff for our inpatients, and then I'll do the pre-op stuff, review the scans again for our OR cases, kind of get everything ready. But actually here I'm in our clinic, so we each get our own room here. So we got our own exam room. It's got pretty much everything that you could want. We got our own microscope. Then we got our own scopes that we have available, both flexible and rigid. So I'm gonna look up some stuff, get stuff ready, and then we'll go around. I'm at patients down in PACU, but wasn't down there this morning because it's a little later start. It doesn't start till 8:30 instead of 7:30. So we're gonna go take a look at our guy here in the SICU, and then we'll go up to our same day surgery center and get consent and everything. All right, consent's done. I wanted to see our last guy up here on the floor, and then we'll go down to the OR to set everything up before tumor board. All right, so that completed our OR case. We got a little delayed start because Dr. Chhabra had to help present a patient at tumor board and wanted to be there for the discussion, so our case got bumped a little bit. So case went well, so it's about 11:30 now, which works out pretty nice, about lunchtime, so grab some lunch. And then we'll write some notes, catch up on the morning stuff, and kind of check in and make sure everything's going well. So I'll head back to clinic for now. Here at the VA, they have a spinal cord unit, so we have a couple patients over here with trachs, and a couple of them have like chronic draining ears that we kind of follow while in the hospital because this is kind of where they live, unfortunately. So I'm about to see one of those patients now, clean out his ear. And then I'll do my afternoon rounds on our primaries. That pretty much wraps up the day though. Got a little bit of everything in, which is pretty awesome. I think the VA is a great rotation as a 3. Really you get a good mix of OR time, clinic time. I failed to mention our clinics are typically, when I am in clinic, I have my own resident clinic, so they're patients that are IC, and depending on the attending is how involved they really are. There's always someone available if I have questions or anything, which is great, but our clinic is full of taking biopsies, doing intratympanic steroid injections, and FNAs, scoping tons of people. So it's a really procedure-heavy clinic, which is fun. And then the OR time here at the VA is, especially as a 3, you start to get that more autonomy in the OR, which is great. Our VA attendings are really terrific. So it's a great rotation. I really love it here, though. Didn't really get to introduce you to much of the staff here. The nurses are great, and they're so helpful. And even up to like the secretaries up front are so helpful with scheduling and everything, because this really does have the feel like you're in a private practice almost, where you're taking care of your own patients. If you guys have any questions or anything, feel free to reach out by email or whatever. Hope you guys consider coming here. Thanks.